Oh, we're trying. You were voice. That's so much. Do you want to get home?
Hi, Angelica.
Hi, guys.
Hello.
Can you all hear me?
Very good.
Yeah,
Okay, good. Hi, Jeff. Sophie, can you all
Hi,
hear me
guys.
in the room?
yes, I can hear everybody.
Okay, perfect. Okay. Let's see.
Angelica, can you hear us okay?
Perfect.
Yes, can you hear me?
Yes, I am. Thank you.
Okay, good. Wonderful.
Yeah. Speakers on. I don't think the speakers. Oh. Okay, good, thank you. What if I might? No. That's good. Microphone check. Maybe turn on.
Test, there we go.
That's yours too.
Test.
Awesome.
Alrighty, so we're gonna go ahead and call this meeting to order in 4:32. Good evening and welcome, everyone. Director, can we please have roll call?
Director Smith. Director Rogers. Here. Director Florencio. Here. Director Longston.
Here.
Secretary Delara. Here. Vice President Rodriguez.
Here.
President Barraza.
Here. Now, if you can please join me, in the Pledge of Allegiance. We're gonna take it back 2 seconds, ready? Right hand over your heart, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Now, item C, approval of the agenda. Any questions? Not, I'll entertain a motion.
I'll say.
Okay, so much.
Okay. We have a first, a second. Can we go ahead and have, well, actually, all those in favor, please say aye.
Aye.
Any opposition? Seeing none, we're gonna move forward. Agenda has been approved. Item D, public comment. At this time, comments from the audience may be made on items not listed in the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Do we have any public comments?
No public comments.
Right. Perfect, thank you. Item E, strategic planning workshop. Now I'll go ahead and hand it over to Sonia.
Thank you so much. I think it would be good to introduce the team for the new year, the new director. So my name is Sophie Bondo. I am the partner at Soen, and I head up strategic development. And I hand over to Leah.
Hi, everyone, and nice to meet you, Director Smith. My name is Leah, and I'm a social impact consultant with Soen.
Hi, everyone. My name is Billy Powers. It's so nice to meet everyone in person. Yeah, I advise on research and policy at Soen.
Hi, good afternoon, everybody. Thanks for having us again. My name is Roy Carmel. I lead the team at Soen.
And Angelica.
Ori, why is your voice so extra deep today? I'm just kidding. I'm just kidding. Hi, everyone. I'm Dr. Angelica Jeter. I serve as our senior health advisor at Soen.
Okay, wonderful. So we're going to jump right in. If there are any questions, Director Smith, please let us know. We're going to give you as much of an overview as we can so we can give you context of where we're starting. But I think it's going to help everybody if we kind of set the stage again, since Christmas and holidays happen and it's a brand new year. So let's see where we were. Okay, so first of all, Happy New Year to everybody. We're excited to start the new year and to continue the work that we started in 2025. As we mentioned previously, the last time we met, started on co-designing the first version of the strategic plan, which is phase 2 of the project. Our project has 5 phases. So we spent the bulk of August to October engaged in our discovery process, which gave us the ability to understand the community needs, the organizations, and the trends that will be impacting the new strategic plan that we're designing. And now we've begun to co-design the first version of the strategic plan. And it bears repeating that this is a co-designing process. It's also an iterative process. So we are in phase 1 of the strategic plan. Nothing is set in stone. This is about co-designing together and adding our ideas. And then the next very exciting step that is going to happen in the process is the community sessions, which are scheduled now. And I believe the first announcement went out yesterday to gain the community's feedback and ideas of what the key issues are facing in terms of health issues are facing the community and how this strategic plan can meet those needs. So we have 7 sessions scheduled. We have designed those sessions to be incredibly inclusive and to reduce as many barriers as possible so that we can reach as many members and as many groups in the community as possible. Thanks to Alejandro, we were able to also speak to the Coachella Collective earlier this month to again invite all of the partners to attend and to encourage their members to attend. And I think that was well received and we got some good ideas and good feedback. And so keeping in mind that the objective for our work today is to focus on the initiative level of the strategic plan, which is a building block of the strategic plan. But again, it's an iterative process. This is about gathering as many ideas as possible. And this is without community per se, input. And then we will come back in March. We will share with everyone here the feedback from the community. We'll probably be in a report. And then we will engage in the second phase of strategic planning, which is incorporating that feedback and refining the different elements of the strategic plan to get us to a final one. Any questions on the process before I move on? Okay. So just a quick reminder of what we're trying to do together. We are designing a 5-year strategy that has 3 central components to it. 1, it has to be, as we know, community-centric and represent the current and future voices of the community and reflect the trends and the diverse and complex community that you are serving. So we have done that in many ways. First, by looking at the health assessment needs and all of the available research. But as I said, the most exciting part next is getting the community feedback on this plan. The second pillar is that it has to be financially viable. So we need to be able to identify and harness opportunities that are scalable and provide sustainable impact and make the most of this new 30-year lease agreement. And the third component is that it has to deliver tangible, meaningful impact. So that we can really show that it is driving measurable and meaningful change for all of the stakeholders that the district serves. Any questions on that before I move forward? Okay. So last time we met, we talked about how we can meet this opportunity that is in front of the healthcare district and how we can harness the full potential of all the good things that the health district does and all of the key qualities it already has. And we talked about the idea of showing up in the world as a health system amplifier. And I think that resonated with everybody. And the reason I bring this back up is just because this is really the way we should show up in the world. And this is a filter with which we should evaluate the different blocks of a strategic plan to say, if we do this, is this really setting us up to be a health system amplifier that can deliver the maximum impact for the community? Just to review what we meant by that, that means that we need to set very clear priorities and standards. We can't be everything to everyone. It means that we need to build on those existing strengths of the district of being a convener and of connecting potential partners so that not everything has to be done by the district alone, but it is about convening the right partners and fueling those partnerships. It has to be an organization that makes decisions based on data and insight, which, as you know, we talked about having a data pillar in the strategic plan to drive that initiative. We want to build shared and scalable infrastructure to address all of the community needs and make measurable impact at a scalable portion. We want to also drive access and awareness and innovation and results, and we want to share those with the community at large. We need to align the funding and operations to system level goals. So it can't just be about tactics. We have the potential to really make systemic change, but it can only be done if we look at the system level goals as well as the tactics. And we need to consider the bigger stakeholder landscape and how we can engage all of the key stakeholders with this unified vision. And then finally, it's about looking outwards, about what can be learned and adopted and shared with all the key stakeholders so that the impact is magnified. Any questions about this idea of health system amplified? Okay. So a couple of rules. When we talk about a co-designing process, we talked about the idea that it's about decision-making and that it ultimately will explicitly cut off some options because we can't do everything. It has to be inclusive of all key stakeholders, the board, the staff, partners, grantees, the community as large. We talked about using a strategic approach that has very distinct strategic modules, the vision, the mission, the strategic pillars, the goals, initiatives, and the tactics underneath. And last time we met, we very quickly and diligently agreed on 4 strategic pillars and 10 goals. So those still stand today. We'll review them before we get started. Okay, any questions on the guiding principles? Okay, so to make it easy, we have handouts today, I believe. And so if you can't read that, you should have them in front of you because it's important, as I always say, to agree on the definitions before anything else. So just to quickly review that we have strategic pillars, which we agreed to 4 of them, and they're the priority areas that basically represents the district's core and enduring focus. Okay. Underneath those pillars are the goals, and they're the directional outcomes that we aim to advance within each of these strategic pillars. And today, what we're trying to focus on is the key initiatives. So very important to understand the difference between key initiative and tactic. A key initiative is a substantial multi-strategic effort, multi-step strategic effort. It's not a one-off that mobilizes the resources and partners to advance a specific goal in a measurable way. Any questions on that? So can I just make sure?
An example of a key initiative.
Yes, I will. If we, I will do that when we get to the mirror board, so that it'll be clearer. Absolutely. Okay, so let's just recap what we hope to achieve today. Today is a starting point. We want to capture everyone's ideas, and we will prioritize in March once we have the community feedback and we have everybody's ideas and we have all the stakeholders' input. Okay. So to get us started, we populated the initiatives with some suggestions. And the suggestions came from a variety of places. Our suggestions, the SOWN team, the prioritization exercise we did back in the fall with the board and the staff, where you selected the current strategies that needed to move forward as we thought about this new plan. We've incorporated ideas that you have shared in previous conversations and in a lot of the listening sessions that we've had together. We've incorporated ideas that anticipate the trends highlighted in the PESTEL and landscape analysis. We've incorporated ideas that come from the community research and the trends and insights that came from the existing research that's been done with health assessment needs and the Huron report and the discussions with the staff. And so what to be sure, and I know I've said this before, but this does not include the community voice. Okay, and that's really important because we know that is a principle that we all want to meet. Any questions about about this? Okay, wonderful. So we're moving along at a good pace. So now we're going to, I want to make sure everybody has their handout so that they know where we are and if there's any questions in terms of definitions, we can answer them. And then we're going to move to the Miro board. So just a recap, the Miro board is our way of collaborating, in a digital world. It's just like a whiteboard, except we can move it from the computer. Okay. So we're going to start with the vision and the mission at the very top, because it's very important. And we should all hold each other accountable. We certainly do on the sewing team. Everything has to ladder up. Everything has to have a through line. And I've said this many times now over the last few months. So we need to always remind ourselves of what we are trying to accomplish. We are trying to achieve optimal health at all stages of life for all district residents. We've slightly changed this vision because originally it was Coachella Valley, and it was pointed out to us
For the mission.
for the mission. Okay, I thought we did for both. Okay, we made it consistent and made district in the mission. Okay, the mission is to improve health access and outcomes for all district residents through strategic funding and partnership building to advance resilient communities. So it's important, we always say this is a work in progress. We always incorporate new learning as we go along because we feel is the wise thing to do. You can always learn something new. So I just want to not open up a Pandora's box, but does this still feel really good and comfortable to everybody? Okay. And the way we, brought that together is we said, we will be a healthcare system implementer. That's how we're going to create change. Okay.
Sophie, where did we put the word equity?
District. Sorry?
Where did we put it? I know we put it in one of the important statements. The word equity, where did we put it?
I think that is actually in the goal, in the strategic pillars.
Okay.
Well, I'll have to remind myself to be completely honest, because I know we went back and forth.
Okay.
And I also think that actually one of the things was that equity would be something that would be throughout. And so it's a filter more than, needs to be included in every single.
That's why I was wondering whether it had gone, like you said, everything goes up, whether, I know we talked about, and I don't want to spend a lot of time on it here, but we talked about whether it belonged here or whether it belonged in a pillar. Are we okay with having it? I'm just asking the board members if we're okay with the mission like that.
And it's outlined in the first two strategic pillars, Sophie, just for you.
Yes.
Actually in the first three.
Oh.
Yeah.
If it's mentioned in several of them, like you said before, that it's embedded in everything, then wouldn't it make sense to embed it in higher up?
What way?
And mention it either in the mission, I think in the mission.
Angelica, do you have a thought on that? I mean, my initial thought is that that's incorporated in the word all district residents in both the vision and the mission.
All
I think-
district residents, okay, sorry, go ahead.
No, go ahead.
All district residents equitably, or something just to. I thought you had a suggestion.
No, yeah.
Those online, I think.
No, for you.
Okay. Okay, to improve health access and outcomes equitably for all district residents. Okay. Because you meant.
How does that change though?
Well, it's because
How does that
it's,
change the mission? For me, it doesn't change it.
Well, for me, because I just think that there's a need to acknowledge that there is disparities and there are different needs for different residents, that some residents may not need as much and others need it more. So that's why I think there just seems to be a gap, like just and this it makes it seem like if they're all like if we're not acknowledging the fact that there are areas of haves and areas of have-nots.
I don't have a problem with adding it equitably to the.
And if you add it here, then you don't have to add it in those three different sections.
So would it be,
We would need to add them in the other areas because it isn't, because it's essential to how we are implementing or filtering and making decisions in those specific areas. Because we have SMART goals that are attached to how we're doing things. So equitable would need to be included. We couldn't remove it. I think part of the discussion that came up last time was thinking about the word optimal. I think that's how we landed on that, if I'm recalling, to achieve optimal health for all stages of life. I think that
Yes.
was the compromise on that.
was it compromise?
I think we also talked about all
Yes,
representing.
that's right, all
Yeah.
residents
Representing
and
the
optimal
equity.
health, that's how it was captured.
And I think we can look at the minutes. I mean, the minutes
Yeah,
are
I
there, but.
we didn't change the vision.
but-
We did, the last time we did not change the vision.
Yeah, but I think it was, we felt, if I recall, we felt like it was repetitive to have equitable and all, because all
Yeah.
serves both.
Yeah.
I think that was.
And all in optimal.
All and optimal
Yeah.
together, capture that.
Yeah.
I was just gonna say, because when you do have all stages of life, maybe in three of the 5 stages of life, you don't have any needs, but maybe when you get older or you're born and you have other needs, but then so you can't really say those that have needs and don't have needs.
They change.
It can change throughout a lifetime, so I like the way that's right.
I think it captures what you're trying to say across all stages and across all communities, is that was the idea with optimal and adding the word all.
And I don't feel like it's inequitable the way it's written.
Right.
No, I don't feel like I'm excluding anybody or I'm not.
And that was one of, I'm sorry, I can barely hear on this end. I'm gonna try to turn my volume up, but can you all hear me?
Yes.
Okay, in reviewing my notes, that was the concern. I know that I think we spent a meeting on the vision, the mission, and that was the concern that came up. These questions around having language that focuses on diversity and inclusion and ensuring that no residents were excluded whatsoever. And I think that's how we landed on all as a part of the focus on health access and optimal health at all stages. Let's see.
Do you have any comments from other board members?
I think it looks fine that way. I don't see like there's a difference. I think the way it is, it looks fine. I don't see there being a difference or not being equitable. I think it includes everybody.
I think to Letty's point, having not participated in the process up until now, but if we're saying that we want the access and the outcomes to be available for everybody, but I think what I'm hearing from Letty is that with also an acknowledgement that certain parts of the community are starting from a different place, which I kind of see as two different things a little bit if we wanted to include in the mission an acknowledgement of that. So whether it was equitable outcomes or something along those lines, if it were going to be in here, I think that's the point in my mind.
So just to recap.
Can I just add one more thing? I'm okay with moving it forward and you're right, we did spend a lot of time on this before.
Yeah.
It's just that when I get to a mission, I always have understood that a mission is how do you
It is.
do the vision, And here, it's through health access and outcomes equitably. I think that's how we want to do it, is we want to do it equitably. So that's what sticks in that's why I think it's important to put it here. But we have spent a lot of time on here. So I feel like if there's consensus to move forward, so I'm willing to move it forward, even though I don't agree with it.
Okay.
For me, I understand the point of like having it on here, but although, and I think that's like we would say a priority or the intent of the board is to move things forward or, improve health access and outcomes equitably. And I think that is what I'm listening from the board is we do want to do that. I don't necessarily have a preference if we include it in the mission statement or not, as long as we make it very clear and within our strategy, within the whole plan, that's going to be the goal. And so I'm for like shorter mission statements. I mean, that's my preference. So adding another word, I don't mind, because it's just one word. But then also not having it there, but making it very clear that that is our intention, because that is what I hear from the board and that is what we want to do. We want to move things forward equitably for all district residents. And so having it or not, I see the value of having it, because that's going to be a reminder for us, like, hey, that's how we're moving, forward, and maybe for future board members as well and staff, as this is the direction of the district. But again, I don't have necessarily a preference, and I hear that. I believe that, except for Lippy, we all are okay with moving forward with that.
Okay.
But as long as we make it very clear that that's our intention.
Yes, and I just want to reflect back to you that we hear what you're saying and your concern, and we heard it at the initial phase as well. We know how important it is to the staff and the board, and that we believe a shorter mission statement is more actionable, and that by adding optimal health and all, but we will keep that close to our heart and part of the process.
Thank you.
Okay. So moving forward, before we go into the different pillars, I just want to share a little bit about, as I said, we have ongoing discussions with, not just yet, ongoing discussions with the staff and the board. And we also met with Jeff and Chris to better understand the legal parameters and some of the boundaries that this plan has to live in, right? To touch. So we basically have these conversations around the initiative to pressure test, like how would this, land and how would this be presented? So two things we want to talk about is, the first is that we really want to make sure that the goals that we identified, the strategic pillars, we found I have two, could you go to the pillars so we can show the colors? Yeah. In these conversations, it became apparent to us that there is two really types of pillars when it comes to implementation, right? 1 and 2 are very much geared and focused on grant making, right? So if we go back. And pillars 3 and 4 are much more focused on becoming that healthcare system amplifier and acting as the backbone and the connector and the convener and the builder of partnerships. Okay, so I just want to make sure that we highlight those two learnings, because it became apparent to us when we spoke to Jeff, for example, that there are even though we want to address social determinants of health, we always have to be very, very focused on our mission and the role of the healthcare district. And we don't want to run the risk of having any missions creep when we talk about social determinants of health. So we need to acknowledge that they are a strategic pillar, that it is a focus, an enduring focus of the organization. As I said before, that's the definition of strategic pillar. But the way that it is implemented is different than pillars 1 and 2, which are very much focused on grant making. Does that make sense? Okay. So with that, let's jump in actually, you know what? I'm Director DeLauro, I'm going to go through the example so everybody has an idea of what we're doing. So let's do a quick overview of an example. And let me have that on my screen. so here we go. So I just did one example for the first strategic pillar. So just to remind ourselves, the strategic pillar number 1 is workforce development. And everybody has a handout, right? So it's easier to read. Okay. And that we defined as equitably increase the workforce of primary and specialty care and behavioral health professionals. That's strategic number 1. And as I reminded everybody, we have 2 goals underneath those, and those are the ones that we are going to achieve in order to bring strategic pillar number 1 to life. And the first one was recruitment. And we define that as attract a diverse, mission-aligned workforce to meet the primary, specialty, and behavioral health needs of district residents. Okay, so that's goal number 1. And as a proposed key initiative 1.1.1, we have recruitment incentive program. So that is a multi-step effort, right, to make goal 1 a reality. And we say it's use targeted incentives and recruitment strategies to attract primary and specialty care professionals to practice in the district. So that's an initiative. Okay. So a program or a tactic that could go underneath that would be a loan repayment or signing incentives, or housing or relocation stipends, or a partnership-based recruitment campaign. So does that make sense? So the first one is a multi-step, which can have lots, many tactics underneath. Does that make sense? And just to give you an idea, really a goal rule of thumb so that it's easily implementable is we want to have something between like 2 and 6 initiatives under each goals. After that, it becomes a little unwieldy. So it doesn't mean that we can't have more than 6 tonight if you really feel strongly, the staff and the board, to add new initiatives. But I have to remind everybody that in March, we will still have to make some decisions. So again, tonight is about capturing everybody's ideas, presenting them to the community. But at some point, we will have to say, what is it that what is the greatest need? What is the greatest tool that we have in our toolbox to make the maximum impact on the community and deliver on this vision that we have for ourselves? Any questions on that? Okay. All right. So how does everybody feel? We're gonna keep going down with strategic pillar 1, and we're gonna move across. So how does everybody feel about key initiative 1.1.1, recruitment incentive program? Keep it, leave it.
If necessary.
Keep it.
Keep it? Okay. All right, so let me move on. And let me just go through the 3 that we have, because that'll give you an idea of what's underneath there.
I guess, the targeted incentives, that's what captures my.
That's all.
That's what.
Let me turn mine off, baby. I'm counting.
Hello.
Okay, so the targeted incentives, we've never done that before, and I guess that's what caught my attention is that that's very specific.
Tactic.
Okay.
Yep.
So, okay, that was it.
And if again, feel free to edit, add, optimize. This is just a starting point.
Carol, can I make a comment?
Can you touch a little bit about what you mean by targeted incentives when you guys have done this before, just to kind of highlight to our board what kind of things you think about when it comes to, obviously recruitment incentives, we think about pay bonuses, but it's way more than that, but maybe just elaborate on that.
Well, I think we can talk about, loan repayment. We can talk lots of different types of incentives. I think targeted incentives initially was meant to focus on those areas of the Coachella Valley where there is a need to recruit specifically. That was the original intent. So originally we had, targeted was more defined as zip code dependent, for example. And we decided to take that out and keep it broader. Does that help?
And these are some of the like examples of ways that you could realize those. So it could be a signing incentive, loan repayment program, and that would be like up to the district to decide.
And I think part of that is, and I see he has a comment down there, but part of it is too, we are not an organization that runs a health care delivery structure yet. You know? And so a lot of that would be probably through partnerships with, you know, because us recruiting physicians makes no sense unless we are much more.
Absolutely.
Yeah. So I think, I don't know how, I didn't see the other points, but just making sure that we understand what you're incentivizing and who you're incentivizing for, because we do have some language in how our lease structure was with the hospital and everybody about how we can be a part of that. So I just want to make sure we get creative about how we think about that incentive, because I do think that's the right idea.
Okay, thank you for that.
A good example.
Oh, you have to turn it on, Ori.
A good example, sorry, is my voice deep enough? A good example.
Yes, it is. It's very smooth today. I think it just might be the mic. Yeah. I think it's just the mic today.
In Dell Hospital down in Texas, no, in Austin. Yeah, they worked with an organization that was trying to answer the same question, and they went out to surgeons actually and asked, what would it take to bring you here, right? Like from Johns Hopkins, for example. They found the most effective thing for them was actually support programs that help place kids, the kids of the surgeons, in the right schools. That was the big decider. Like, that's a really interesting and creative way of thinking about incentives. It's not always direct, hey, we'll give you a cut here, or
Correct.
It can be other things that are really important to the people who we want to bring to the district.
Which I love that. I think for us, I want to make sure we highlight that in the context, and Jeff will talk about it a little bit, about how do we actually incentivize that when we have two health organizations here that we can't support one or the other. So I don't know how that happens, but I really want to be specific about that, because I think the idea is right, but how do we as a board function that way? And I know this is just a key initiative, but I'm not sure we can actually target and incentivize anybody with our role as a board and currently how it's structured with our relationships with the hospital.
Well, I think we can. I think there's that opportunity.
But
yeah, I think there's that opportunity that where we're not hiring the medical providers, but we can partner with, say, a residency program, for example, that if they're coming out of a residency program, we can provide funding to allow a resident to for a loan repayment. So we can set up as part of their incentive to, say, stay in the community, to help a loan repayment program that if they stay for so many years, that their loan is repaid by, you know, funding that could come from the healthcare district. And this was discussed with Jeff. So I think Jeff he's nodding his head yes. So that's something that we can do. So something along those lines, or something to possibly help out with residents, being able to, you know, help them get into, you know, someplace to live, or like Ori was saying, some kind of a program to help get the kids into school that helps incentivize those providers to stay in the community. So that was kind of, you know, where we were thinking along some of the support with this initiative.
And I had a conversation with Michelle along those lines at Desert Regional, and she made the point that the hospital policy is to provide incentive for the new physicians that they recruit, but it only goes up to a certain point in terms of salary repayment or assistance with renting a facility, and that's something that the district might just build on and help. We're not helping the hospital, we're helping the physicians.
So just for clarification, the purpose of
of the activity that we're engaging now is to determine and add key initiatives and then determine if we're gonna move them. And then I'm assuming that we'll have time to actually go into more of the tactics in the
Exactly.
future. Okay, just for clarification, so that.
That's good.
Yes, so, yes, 100%. And the idea is to have everybody's inputs before we go to the community. Of course. And get your feedback.
I just want to reiterate, Dan, you brought this up, and it's in the mission statement about the partnership building.
Yep.
And I think when we get into the tactics side of that, then that's when we can really highlight what those potential partners would be.
100%. So I just want to, first of all, commend everybody for jumping in with ideas and also really, really sticking to the definitions of a key initiative and bringing up those ideas. And I just want to make sure everybody knows that we're capturing all these ideas. And it'll be a very similar process when we go to the community, right? It's going to be capturing these ideas and then we'll come back together. So thank you so much.
Last comment on that statement, because this is a huge point. Are nurses included in this? I mean, when you say primary and specialty care, do you read it as such?
Using
I just want to make sure, but we all interpret that, because when I think about primary, I think about primary care. When I think about specialty care, I think about, a specialty physician. They need to be included in this, and I want to make sure as we read that it's all the health providers that are here, because it's a shortage in all areas.
Yes, we've aligned these with the current definition.
Okay,
So
so
it's
you're-
beyond nurses. It's,
Perfect. I just want to make sure that was a gross understanding across the
yes,
board.
and I'm sure there will be a definition sheet that aligns, but for now you can assume the same definitions that we've used.
I see this one.
Yeah.
And I think Jeff has a comment, Sophie.
Oh, okay.
Are you talking to me? Okay, yeah, no, I mean, we do these programs, doctor, all over. Grossmont has these recruitment incentive programs, and frankly, the district's done it over the years. I think when we were with UCR, and so there's ways we can structure this so that certainly from a legal perspective they're appropriate, and utilizing other other providers, if you will, to do this. But yes, we can do it.
Good to go.
Thank you.
Yes. Wonderful. So let's move on to the second key initiative, which is more focused on growing the workforce pipeline that's existing in the Coachella Valley. So develop a culturally responsive pipeline that prepares, trains, and places primary and specialty care professionals in the district. Again, that could have a number of initiatives underneath.
Any comments?
Tactics.
A tactics underneath, sorry. Okay, let's move on to 1.13. And this one focuses on the behavioral health workforce strengthening. So focus recruitment efforts on expanding behavioral health capacity to strengthen access to mental health and substance use services in the district. Okay. So we have 3 underneath this particular goal. Does anybody feel strongly that something should be added?
Is that, and I was gonna ask Greg, because he's kind of like the behavioral health expert. Isn't the SAMHSA definition, is it behavioral health with mental health and substance abuse under it? Or is it mental health with behavioral health and substance abuse?
I can't remember.
You remember? Okay, just.
But really, behavioral health now captures both mental health and substance use. But we still call out substance use because the lexicon of behavioral health is not as well understood. But you're right.
I have one last question, and I promise it won't be like this all night. Does the pediatric population need to be mentioned in here? We have a huge gap in pediatricians here. I can't even name more than 2 that are here, and I work in the community. I mean, there are a few, but it's I think the mental health has been a big component. I think making sure we focus on, you want families to grow here and thrive here. You talk about taking care of their kids. There aren't physicians here that do. There's 0 pediatric practices that I know about. Go ahead.
So correct me if I'm wrong, but I would read that
Dan, going under the professionals, primary and specialty care would be pediatrics.
Yes.
And then I think what we do to specifically address pediatrics is then when we get into the tactics,
Yeah.
is we could call that.
Like a specific pediatric residency program, for
Exactly. Okay,
example,
so-
would be.
I also see with mental health, is there also like the psychologists, psychiatrists are primary care in mental health. So when I read it, I just saw that we called it out separately and I was just making sure we don't need to call that out in addition.
Right.
Yeah, and that
Sounds
was
like
in
we're good.
response to like conversations that we had last time, because it seemed very like important to the group to have that distinction.
Yeah.
But yeah, to your point, like that would be something decided by the organization to prioritize as a tactic.
How's it? Okay.
We're good to move on? Okay, wonderful. Thank you so much for your input, everybody. Keep it coming. It's fabulous. Okay, so goal 1.2 was all focused on retention, retain a skilled, stable, and culturally responsive workforce that can deliver high quality care across the district. So here we have 1.21, which focuses on retention incentives and community integration. Provide targeted incentives and coordinated support that encourages primary, specialty, and behavioral health professionals to remain in the district. And 2 would be focus on workforce support. Support healthcare providers through supervision, peer support, cultural empathy training, and professional development, particularly in primary and behavioral health settings serving the district.
We keep going.
Okay, I'm taking your lead. All right.
You're capturing a lot of what we thought.
Yeah, you're capturing a lot of what we've already talked about.
Which makes me feel good, because that was the idea, was to reflect back a lot of the conversations that we've had and a lot of the input that we've had from the board and the staff and the landscape analysis.
Yeah, and I think we're kind of all realizing now that we'll get more specific when we get into the tactics.
Yes.
Actual program.
Yes, and what you fund, exactly. Okay, so I'm going to hand it over to Leah, and we're going to move on to strategic pillar number 2.
Okay, so to reiterate the pillar that we all agreed on, it's around awareness and access, and it's to equitably increase awareness of health services and access to primary, specialty, and behavioral health care services. And we had agreed to 3 goals. So the first one is around awareness, increase community awareness of the health services available across the district. And I'll make a quick note. I know Sophie alluded to this earlier, but in speaking with the staff and around the service area of the district, we decided to use district as the label for all residents. So district residents rather than Coachella Valley residents, so that we're truly
specific.
Yeah, reflecting the actual community that legally the district can serve. So you'll notice like little changes in words, and that's why. And then goal 2.2 was around physical access, reducing barriers that limit district residents' ability to access in-person care. And then the third goal was around digital access. So increase the availability of and ability to access virtual and telehealth care across the district. So for each of these, we have one key initiative that we felt was most representative of what the district can and should do based on all of the sources that Sophie listed. So under awareness, the key initiative is around connected care navigation, support a coordinated, culturally responsive approach to health awareness and navigation so residents can more easily understand what services exist and be connected to them across the district. Does that resonate with everyone?
I'm okay with that, but I'm just wondering, if maybe I should wait until the end to see whether it comes up. But when we've talked about partnerships, identifying partnerships, like the school district and awareness there that of not being acknowledging the fact that we don't do everything on our own.
Yes.
We're more successful when we connect. So awareness, would that be here or would it be later on?
It's tactic, right?
So that is, the partnership is coming in the awareness in the third pillar mostly, where we are going to focus about how we deliver those social determinants of health through partnership and being a convener and acting as a backbone for the community.
Where is that?
And goal number 3.
Goal number 3. Thank you.
Yes. And it doesn't mean, by the way, that partnerships can't be part of goal number 1 and 2 as well. That's a tactic for sure.
Oh.
Ori, did you have something to add? Okay, moving on to 2.2, physical access. The key initiative is high need access expansion, support programs and non-traditional delivery models that facilitate and expand access to services and care for district residents. And I think one tactic that will definitely be here would be the mobile units.
By the way, as we're going through these, if I were you, if a specific tactic comes to mind, write it down.
Or share it with us.
Or share, yeah. Because we're gonna go through the tactic. Oh, there you go.
Which I'm surprised. I was sitting here thinking I'm so surprised that we aren't hearing more ideas. We want to walk through each step, but we still want to be able to collectively gain all of your ideas as well.
I don't know if this is a tactic or an initiative, but I see here when I read through the high need for access expansion, it talks about supporting programs and non-traditional delivery models. Does an initiative need to be that in terms of physical access that we as a organization look to procure or be a part of actually owning more physical access? We have currently owned physical access. We sold our hospital, which was physical access. I don't know if that's a tactic that really fits under that initiative or not. So whatever, I'm open to your suggestions, but it's not non-traditional and it's not a support program. It's a completely different line item for physical access.
Sorry, I was looking at you.
Yeah, one woman that we met at the APHA meeting in DC told us about how her organization provides Uber drivers for appointments. Yeah, so that
would be a support program.
A support program.
Which is covered in this initiative, but,
Yes.
but actual physically owning a real estate or an office building like we do, I don't know if that's covered here or is that a tactic? It doesn't seem to fit under the first initiative.
I think that's an initiative under this with physical access.
The tactic, yeah.
It's like 2.2.2.
Yeah, it would be another one. It would be an additional.
I think it's a separate initiative.
So you want to put that on here?
Yes, it's.
Yeah, and that's part of this exercise is as we're thinking of potential new initiatives, not just the ones that have been starting here, because it can be a laundry list of initiatives. We may need to narrow them down.
Yeah.
A March.
Yeah.
And after, meeting with the community members and such, but this is, for lack of a better word, kind of a wish list of initiatives. And I don't want to say that to where it becomes, like 20 initiatives under each
Shouldn't be.
goal.
Yeah, very
But
focused on
it could be such to where we have more than, say, the 2 to 6 and need to narrow it down some. But I think it's better if we have those thoughts and ideas for initiatives that we include them during this exercise, correct?
100%. 100%. That's. Yes.
This is a working session. So yes, let's.
And I just put this to give us something to start with, but if there's a phrasing or a way that the district should
That's good. That's a
present
start.
this initiative.
Jeff, do you have? Are you on?
You're on mute.
Yeah, I mean, I think, we can take a look at that, but I think that covers it. I mean, we can use procure real estate, for in-person care. I mean, I think you've got a pretty good notion there.
Okay, great. And just to take a pause we've covered awareness and physical access. Are there any key initiatives that we're missing? So any ideas that you can think of that don't fall under one of the initiatives that we have?
Also, sometimes it's hard to think on the spot. I mean, sometimes it's good to bounce off ideas and build on each other's ideas, but if anything else comes up, you can always send it to us or send it to Chris and he'll send it to us. If something comes up when you're driving home tonight, that's sometimes when we have an inspiration. So we don't want to also put you on the spot. It's not now or never. Really important.
Where would establishing more FQHCs in the district fall?
That would fit under the physical location.
Physical access.
Supporting.
One of these, depending on your role, whether it's supporting organizations who are opening one or. No, I'm good.
Would possibly residency programs fall under this as a key initiative as well? And yeah, and possibly with, sponsoring institution kind of a process and developing our own homegrown residency programs, if that's something that the board wants to consider.
Which fall more under
Pillar one, I think.
Right.
I think we captured it.
I wrote that down under pillar one.
Okay, so I think we should add it along the way since we're talking about it. If it's that's an initiative that we want to add under the pillar one.
I think it's a tactic under the workforce.
Yeah, but we can definitely, I'll add these. So again, if there's any tactics, just call them out and I'll put sticky notes and we can come back to it.
There's a list of them. We don't want to open that right now. I think if you start opening tactics, we're gonna go. It's good to keep us focused on initiatives because you've worked us down. Just keep working us down slowly. We all have a lot of.
You're speaking my language, like one step at a time, one building block at a time, for sure.
Biting my tongue.
I know, but doesn't mean that you shouldn't capture them.
You're captured, don't worry.
Okay. And if you don't share them, yeah, okay.
Hand them to you.
Yeah, that would be wonderful. If we can read your handwriting, hand over your notes if you're feeling.
They're all doctors. We're not going to be able to read their handwriting.
All right, so I think it's over to you, Angelica.
We didn't do the last one.
Oh, you didn't do the last one, sorry.
I think this one will be quick, because we've already discussed telehealth, but digital access, the initiative would be digital access enablement. Expand access to virtual care by supporting telehealth service delivery and resident digital navigation that enable effective use of digital health tools.
Okay, so here, this to me goes back to the equity issue. Okay, so I don't know if we were to add another initiative to address the fact that there's that issue that people are not going to be able to access digital access if they do not have broadband, have the infrastructure and have living environments where they could actually access them and even understand it. So I'm open to suggestions on how we would address that, or is that tactic again?
I think that the resident digital navigation was meant to capture some of that. So if there's lack of access to those tools, but if that doesn't feel like it captures it, we can add the word equity. Or Angelica, I know you had a comment too, sorry.
No. I see the difference in what she's saying. So the way we have it written here focuses on service delivery, and then the assisting the resident being able to navigate the system once they have access. But the step that I think, and please correct me if I'm wrong, what I'm hearing is that we're talking about before they even get to the system, ensuring that they have access to be able to get to the system before we help them navigate the system. Correct. So it is a separate initiative that focuses on, it's a similar topic, but it just focuses on equitable access to the internet, essentially.
Thank you, and I appreciate that because those were going to be my comments, Director Ladana. You just being you were able to like frame it quicker. And I'll give you an example just for context. During COVID, school districts, children were remote. Some children's their houses, or not even just their houses, there's some areas within the Coachella Valley where they're just like the
Yeah,
some.
we actually experienced some of that.
Okay.
Driving around.
Yeah, and so I agree and I appreciate that we are gonna have it as a key initiative. I'm wondering if there's other comments from board members on that, but it's a real issue.
I strongly agree with that. I think it's.
I strongly agree with that. I know a little bit about what we call the digital divide in the digital world, and it's very, very real, and it has lots of components of it. By the way, it actually ties into social determinants of health as well, which the next piece that we're going to be talking about. I think this is a really good addition, personally.
Yeah, it made me think about when I was chief health officer of Atlanta, and our students were trying to get access to certain resources, and they couldn't go to school because they did not have the internet. Their parents couldn't see their doctors because, again, they didn't have the internet. So we understand how those things haven't shifted that much even since the pandemic. So thank you for lifting that up during this conversation.
So are we making that another key initiative?
Yes. Okay, so I think that was a great addition. I just want to make sure we hear from the staff, because I know, like I said before, pressure testing against the reality of implementation of obviously part of the work that's going to happen once this strategic plan is put in place is how it's going to be adopted by the organization and what organizational change are going to be needed in order to implement it. So I just want to make sure that we hear from everybody. Does anybody on the staff want to add anything in terms of initiatives? Or any thoughts? Donna? You're fine.
I was thinking, like Letty mentioned too about the broadband, and that is something now the defunct CVEP and Joe Wallace had been fighting for years about that. And he couldn't even get the workforce because there was no broadband. It's bad broadband. So that's where possibly the tactic is some kind of partnership with somebody that's already addressing that. Then I was thinking about what Angelica said about the equitable access, COVID in Atlanta and stuff. So would a tactic be looking at best practices from COVID that addressed those kinds of things?
Yeah.
Absolutely.
Okay.
It's a great idea. Alejandro also has a question, or
City of Newark has partnered with mobile service providers to solve exactly the problem that you were talking about, dead zones during the pandemic.
Yep, and that's what we did in Atlanta as well. Yeah.
Yeah, I know the school district, Coachella Valley Unified School District did have a pilot project where they would have the school buses that were actually, routers that they had Wi-Fi, and they would actually park some of these buses, school buses, out in some of the unincorporated areas like North Shore, Thermal Oasis, depending where the need was. So I think that might be a viable option, kind of, explore further with the school district, or even look at some of these broadband providers, look at, AT&T, I know is very heavy here in the Valley, and we do have a representative here that is very involved. So maybe looking into that partnership to see how we could actually work with those entities that build out the broadband and increase some of those hotspots in the unincorporated areas. And not only in the East Valley, we also have issues in Sky Valley, Desert Edge, Thousand Palms, etc. So I think when we talk about equity, we also need to shift a little bit from the eastern part of the valley and look throughout the Coachella Valley.
Wonderful.
Well, yeah, I was just going to say that the key word that I heard was partnerships, and the pillar 3 is actually anchored in two things that are very relevant to this, which is the digital divide is a social determinant of health. And so fundamentally it falls under the purview of something where it has profound health implications, but it as a subject matter in isolation isn't necessarily a health initiative. And secondarily is exactly what Alejandro just said, which is a fantastic initiative example, which is for most relevantly for the grant making functions of the district, which is pillars 1 and 2, that is an education initiative in that case that has a digital sort of focus. and not the other way around. And so just I don't want to get ahead of Sophie's magnificent presentation, but Pillar 3 is all about like thinking through a million of these examples that we really want to be very intentional about.
Magnificent is a lot. But
it's an understatement.
Yeah.
I think
You know, this area is there's a real huge amount of work that's been done around digital access. So this is an area actually where we don't have to make anything up. There's plenty of examples. Another example talks about policy. So multiple cities give incentives to mobile providers to come in, right, and lay literal pipe, right, like fiber optic pipe. And we can create an initiative that talks about how do we influence policy so that when regional council allows or disallows Verizon or Fios or anybody else to lay new pipe, they get an incentive to do that. They have to do that in specific neighborhoods, for example, and do the research, right? Partner with a research organization that helps us identify the right research to present something like that to council, to regional council.
Okay, so 2 points. One is the district does a lot of podcasts and a lot of trying to get the word out and to educate the community about what are some of the services that we have available and educate about health. When I think about awareness, is that a tactic, or because I see it as a separate thing than connected care navigation? So I'm just wondering, would that be another initiative about how we communicate with the general public? So that's one. The other thing is you just mentioned policy, and we talked about that at the last meeting that we actually added it, and I don't see it somewhere. So maybe you can point out to me where that's at. So that's it.
So both of those are tactics, which is why they're not visible today.
Okay.
But noted for sure, and both important. Absolutely. And critical to becoming a healthcare system amplifier, for sure. Okay, so I think we're going to head it over to Angelica to stay on time and to go over strategic pillar number 3, if that works with everybody, the staff and the board. Okay. Angelica, over to you. You let us know if we need to move anything on your behalf.
Question.
Yeah.
How long are we gonna be? I'm just checking on the board. Are we okay? Do we need a potty break?
We have another hour, but we're doing really, really well. So, because we have to get that speakeasy. All right, Angelica, over to you.
I'm going to, let's figure out how we can navigate this because I'm moving things around on my end. Can you all see me moving the screen?
Angelica, I don't think you're sharing your screen, but I can unshare mine if you want to do that.
Okay, I was wondering if that would be easier. That'd be great. Yeah, because there's a couple of things that I want us to flow through. Perfect.
Yes.
All right. So let's hope that technology will let us be great today. Have my otter going, of course. Okay. Can you all see my screen now?
Yeah, perfect.
Yes,
Okay,
if you
I'm
don't
gonna
mind just
zoom
zooming
in.
in a little bit.
I'm gonna zoom in for sure. All right, before I zoom in though, I want us to just kind of remember the process of how we got to these 3 categories. We went through the process of making a decision to focus on the social determinants of health. We talked about some key partners that we want to engage. And then we talked about this larger social ecological model and framework that we really appreciated. And it included some pieces around policy. It included some focuses around living conditions, just really getting to the equitable approach to ensure that we can see a broader scope of the potential, with the understanding that we will have to narrow all of this down because we can't do all of the things, right? And so within our conversations, we landed on the strategic pillar of engagement, with this focus on engaging strategic partnerships, programs, and funding to equitably address essential social determinants of health. There are three key areas that we landed on under this category. Before we dive into those goals and the initiatives, I want us to remember that the overall social determinants of health, can you see my screen where it has this picture, this larger focus? Okay, perfect. I want us to remember that these 1, 2, 3, 4, 5 key areas are embedded throughout the entire strategic pillars, which is why we don't have everything listed under engagement, because a lot of this is already embedded in the work that we're doing. So, excuse me. And going back to the overall goals and remembering that a lot of this is based on our previous discussions and reports that we've reviewed and landscape review on our own and our own knowledge, background, and experience. Goal 3.1 focuses on neighborhood and built environment, really strengthening the neighborhood and built environment conditions. Excuse me, I'm going to take a sip of this. I lost my voice just in time for me to start talking. I apologize.
What's in it?
Okay. I might need to borrow your voice, Ori. Okay, the first key initiative under neighborhood and built environment really focuses on healthy housing and stability. Can you all see that? Is that zoomed in enough?
Yes.
We all have paper in front of us.
Okay, good. Yes, wonderful. So supporting programs and align partners around strategies that improve housing stability and integrate health supportive services in the district. Is that an initiative that we should continue to center under engagement?
Yes. Silence.
You got housing. I like it.
Okay. All right. The next one focuses on healthy air and water. That was something that came out of some of the reports and some of the feedback that we received from the board. I know there have been discussions amongst the team in how feasible this is. I think this aligns with supporting of programs and partnerships, not necessarily something that the district would have to do, but aligning with the key partners to elevate this, because understanding that when you have healthy air and water, then you're more likely to be healthier overall in various ways.
I would just add here that the district actually is involved in this through the Environmental Health Summit. So that's a tactic that we can do as a district that brings those other partners together.
Wonderful. Thank you, Leah. I see you capturing that. I appreciate it. Anything else that we want to add under neighborhood and built environment? Any other key initiatives?
Form health assessment impacts.
Love it. Can we add that, Leah or Sophie?
What is that? Yeah, that's a study done.
So if you look under pillar 4, under initiative 4.1, it has assessments in it.
Oh, yes, that's a different pillar.
Not sure where this falls in, if it was pillar 2 or pillar 3, so I held off until pillar 3. Where does our engagement and involvement and awareness around what's happening politically? I know we have a lobby group that works for us now to go have some impact in Sacramento. If you talk about supporting your neighborhood and your local area, you really have to have both state representation, because I think we represent the city pretty well, but state representation as well as federal representation. And so I don't know if that's an engagement or an awareness, but I don't know which goal it necessarily fits under, but I think it should be an initiative about us being something around involved in that, but being involved in the political, creation of what's going on in our communities here. Because we're not, go ahead.
It fits under the social and community context category for sure. And we internally have been having our own conversations, and I'm happy that it's been brought up today, just thinking about how we navigate this, because we know that the political climate could be present as we are doing community sessions. And so that's definitely something that we could add under the goal 3.2 of social and community context.
Yeah, and thanks for bringing that up, Dan, especially since we just implemented legislative committee and all that.
Yeah.
Our policy. So I do think it fits well under 3.2 as well.
Awesome. Well, we're gonna slide over to
Hold on,
3.2
there's
then.
more questions.
Okay.
There's two more.
Okay, great.
Leaving it for the next one.
Well, and since did I have in front of you?
All right.
Talking about healthy air and water, was there any discussion about climate change and or extreme heat impacts? Addressing, issues around that, particularly concerning seniors in the community, since they're represented quite largely.
Mainly focusing on air and water. There's the story behind it because of some work that we did that was done, I want to say, because of some fires nearby a school and an initiative that the district ran before I was on the board. But I believe that, that's another good point. If other health or extreme heat stuff. So, yeah.
I think there may be room to find a place there, either to add a full initiative or add
a word.
the word to one of the existing initiatives around, combating climate change issues.
Extreme weather.
I think it's representing too. I think it's recognizing too that we do live in a desert, and you have people in the high desert that we represent, and it's hot. It's 130 degrees. There's people with no AC. So I think just recognizing that is a problem when it comes to quality of health. So I think maybe we wrap it in under healthy air and water and put something in there around our use word climate, but something around where we live here, understanding the extreme. Maybe it is extreme climate that we live in. I don't know.
Like mitigate the unique climate conditions of the desert.
Yeah, just recognizing it and understanding that might be a limitation for some people.
It reminds me of the work.
I was next, Madam President.
Practicality, you just have to do this.
Of the storms, like Hillary.
And that's what I was gonna mention, is that we have had responses to storms like that. And also the cold weather, the cold weather shelters. So that is totally in line with climate change and Hillary. So my thing that I wanted to bring up is, I don't know if it fits here, but when I think about neighborhood and built environment, I also think about communities that have greater, social issues like access to guns, access to drugs. So that is health, behavioral health, and so I don't know if that's here. I would like to make sure that it's somewhere. I think it's social. I wasn't sure whether it was social and community context, but just acknowledging that there are communities where the conditions that young people are growing in, that they have more likelihood to actually follow in those steps.
Yeah, we would definitely put that under social and community context, because there's some pieces around safety and well-being and how that impacts overall health. So that would be great to add that under there. Thank you.
I just wanted to add on healthy air, water, and extreme weather. I would also like to see maybe the health impacts that the environment actually has on general health. I think we've been with the mitigating air quality RFP. I think there's some maybe really good programming, best practices that might come out of that. So I think just continuing down that road of how the environment impacts the actual health of our district.
I like that.
I think that's part of a tactic to do.
Yeah, well, we're adding, throwing in tactics now. My only addition is that I know that there's an increase in valley fever, which in this area, especially in agricultural areas, caused by mold. And we're seeing a big expansion or explosion of valley fever in the state, and especially in agricultural areas.
Thank you for sharing that. And as we think about our engagement, so much of this is going to be focused on partnerships and how we leverage the relationships that you currently have and establishing new relationships with leaders, organizations, key partners that you haven't been able to engage just yet. And then continuing to expand on those tactics. So please continue to keep those ideas flowing. Is there anything else? I know we've kind of slid into the social and community context portion. Anything else we want to add under this piece before I dive into the promotion of nutrition for health?
So my only comment would be, you put in the safety and well-being initiative. Just my thought under that as a tactic for those taking notes is the issue of loneliness, especially amongst seniors and parts of our community. I think we can play a role in there.
Yeah, absolutely. I have lots of ideas for that category.
We worked with ARP for a long, long time, and I would certainly like to make the connection at some point between you guys and some leaders at ARP if you haven't talked to them before.
Yeah, and I would love to expand it beyond seniors because we have loneliness across the board, especially for our youth, and understanding that suicide rates and all kinds of isolation because of social media and so on and so forth has created this large divide as well. So I would highlight seniors, which you have, thank you, Leah, and then add community overall within that. And we can look at some of the stats to really.
Yeah, I agree with you 100%. And we actually have some of the highest suicide rates in the Eastern Coachella Valley. So.
Oh, wow. Thank you so much for sharing that with me.
And in speaking to some of the residents that, in my area, especially in North Palm Springs, that there is a void in grocery stores and being able to even get healthy food. So, and they were talking about establishing a co-op grocery store type model.
And could you put that under a neighborhood and built environment, Leah?
Food insecurity.
Yeah, I think it's already, we had talked about including that within
It's already part of 3.2.
3.21.
Okay. Okay, perfect. Thank you. Awesome. Anything else that we want to add to 3.21 under promote nutrition for health? Okay, so the last category focuses on economic stability. During our last conversation, we talked extensively around the state of the world, access to care, being able to pay for the health services that people need to be able to have access to, and then also job loss. And the fact that so many people haven't lost their jobs or they never really had access to equitable pay. And as a part of that conversation, we landed on strengthening economic stability for district residents. And one of those key initiatives focuses on expanding pathways to economic vitality by convening and aligning with partners that expand access to career pathways and employment opportunities within the district. Any thoughts about that? And I see, Jeff, you went off mute. Did you have any feedback on anything?
I think it looks.
I'm not sure. I'm not sure if this one would go here either, but the issue that we're having with the federal government and the Medi-Cal, access to Medi-Cal. Being able to address the insurance, the lack of insurance, the underinsured issue, if that's something that would put in here.
It's access.
Would that fall under the policy piece? Also the access piece?
Awareness and access.
Awareness and access.
Yes, and access.
Yeah.
And then the tactic though under the policy one could be advocating
Right.
for.
But actually,
supporting organizations that are trying to get signups or trying to even provide like volunteers in medicine that are trying to address that problem that's being created.
I think you're covered. I think you're covered under 221, support programs and non-traditional delivery models that facilitate and expand access to services. And one of the tactics can be, I think understanding the changes in Medi-Cal and how that's affecting our community. If you're okay with that.
Yeah.
And
I'm just currently doing that right now. Okay, I think that's already an effort that's already being done.
Yeah.
Oh, educating about the new requirements.
And I think part of the work that we do with the mobile clinics is anytime that we encounter somebody that is underinsured, we do connect them with entities that do Medi-Cal enrollment. Like the JFK Foundation often comes with us. The department, the Riverside County Department of Social Services, they come with us. And they also do CalFresh enrollment. They do Medi-Cal enrollment. So we're able to kind of add on some of those services when we roll out with some of our mobile clinics.
Director.
Awesome.
You won't need to get on your treadmill tonight. No, I was just thinking that our College of the Desert is a big provider of workforce development and just announced that they're giving free tuition to all of the residents in the valley. And another organization that we can think about partnering with.
A little bit to piggyback off what you were saying, Alejandro. I know that the California State Bar puts a significant amount of funds into legal services providers to do things like public benefits. And so helping get IDs, signing up for health insurance, in particular, also helping with Social Security and things like that. So I don't know if it specifically falls under, I mean, it's associated with economic stability. It might go back to under goal 3.2, but also acknowledging that aspect of it as far as the legal assistance, but helping with even accessing benefits in the first place that can help improve economic situations and health outcomes ultimately.
Love it. And are you going to move the one for 3.2 to, I guess, the additional one that's under economic stability? Are we moving that one, everyone? Okay, perfect. Thank you so much. I think that's it for me under strategic pillar 3. And with that, I'm going to pass it to you, Ori. Thank you, everyone.
I just have one more point that Anise reminded me of, and that is the county, I guess it's the district attorney's office, helps people erase their criminal records so that they can get employment.
I like that. Thank you for sharing that. So many ideas. I'm holding my tongue as well. I was like, there's so many things, but yes. Anything else from anyone else before I pass it over to Ori? All right, I'll pass it to you, Ori, and I'm gonna stop sharing.
Angelica. We've gotten to the best pillar. Strategic pillar number 4, the data-driven one, right? So as a part of being that architect that we talked about earlier, we really want to, Angelica, do you mind moving your cursor?
I'll just share.
Yeah, I'm not sharing anymore. Let me close it out.
Share.
Okay, thank you.
I got you. Perfect. There we go.
So the pillar description that we landed on, lead in aggregating, sharing, and utilizing data to drive evidence-based decisions for community collective impact. Sounds like we're still comfortable with that. I hope so. The way that we thought about this was in 2 real sets of activities. The first one is all internal, looking inward. What are the things that we need to do as an organization to make sure that we have the right data, that we make the right decisions with that data, that we have the right tools and capabilities and resources. And that's what you're seeing in goal 4.1. We're kind of giving it the name of data maturity, right? Becoming a data mature organization. And that means Becoming a data-driven organization that makes informed decisions with relevant and timely understanding of stakeholder needs and wants. Right, so this kind of integrates who we are and who we want to be as an organization with what's around us in terms of the needs and wants of our stakeholders. Does everybody still feel comfortable with that?
Mm-hmm.
Changes, comments? Okay, cool. A couple of initiatives that we thought would be interesting to explore here. The first one, strengthen internal data capabilities and governance. This is a major one.
Mm-hmm.
There's a lot of different initiatives, a lot of different activities that will need to go into this. So we're describing this as develop the people, governance, tools, and processes needed for the Desert Health Foundation, for Desert Health to consistently collect, analyze, and use the data to inform strategy, funding decisions, and organizational learning. There's a lot in there, but breaking it down. So develop the people, governance, tools, and processes. So all the things that we're going to need. What are we going to use those for? To consistently collect, analyze, and use data. And keep in mind the word use data, because right now, today, we're collecting a lot of data that we're not necessarily using. Right? And why are we doing all that? To inform strategy, funding decisions, and organizational learning. Questions, thoughts? Okay. Cool. Key initiative 4.1.2, advance outcomes and impact measurement. Advance a shared outcome and impact measurement framework and embed consistent reporting expectations into funding relationships. We spent a lot of time with Gracie and Megan talking about this today to support learning, accountability, and collective impact across our investments. Today, there's a lot of gathering of data, right? We have a framework in place. It's a good framework. Right? We've implemented it, what, 4 years ago? It served us really, really well. Right? It took us from an organization that doesn't even think about data, really, to an organization that starts getting our act together. It's time to further evolve that. And if we don't, we're in big danger of falling behind. Questions, thoughts, concerns? Does this feel right? Any comments?
Talk about RBA. Is that really collecting data, or is it more collecting performance measured numbers that the grantees are reporting to us and what they're spending their money on?
That is data.
That's data.
That's a part of what we need to collect. That's a great question, but yes, that's a part of what we need to.
Do we compare it to national data?
Well, you can do whatever you want with it. You may be the tip of the spear saying this is how people are spending their money. There's not a lot of people publishing that data about how nonprofits are actually spending grant dollars. You hear in the, can I have the microphone?
Yes.
There's nobody to run around now. See, I had a role.
I'll do it. I think that data is critical. This is a huge point for me because there's so much talk about grant dollars being wasted in fraud, right? It is. And if you can publish your data about how your grant dollars are being spent and be very specific on it, data is invaluable to the national conversation that's going on because there is fraud. We know that. But it's also, well, what are people actually doing with it? Nobody can answer the question.
And what happens as a result of what people do with it? That's the real question.
We can see that impact. We don't know how they're spending it all the time. But when you see how they're spending it, we sign their checks. And they give
return on investment.
One of the things, sorry, bud.
Sorry, but I just signed a bunch of checks for every grant. And in there, it's exactly what they spent all of that money on. Like, if you take that and then publish that data about how grantees are spending dollars in our healthcare space, that changes a lot, and even at the national level, about how publicly funded grants are actually doing good work. It gives you insight into that conversation, which currently is not happening. It's very polarized right now. And so even the stuff I signed tonight would have been valuable to have in a data set And then we publish that on a quarterly basis. Here's how the money's being spent in this healthcare district specifically. And it may inspire other districts to publish their data in a similar way. And next thing you know, now you've got a national collection of data about how public dollars are spent and having an impact. But right now, we don't know where they're being spent. We know what organizations they go to, but once they get there, we don't know what happens to it.
So,
Yeah.
Okay, so I just wanted to add, Donna, that I am kind of like you, but I haven't been certified like Megan and all the data and the expertise that she has. So I'm more of the jack of all trades and master of none kind of a person. Okay, so but my understanding of it from my position is that we do use data when we are utilizing RVA. We're using national, local data, all of that to be able to frame our story, to be able to make assumptions that are based on experts and performance and history. So that is the basis of it and how we evaluate that. So it is part of it. But what I'm learning is that the data that we're generating is, like Director Longston has said in our many meetings, when he asked for follow-up questions to Alejandro's report about the medical clinic and about the cost per unit and all that. Sometimes we forget that that's the kind of data that we don't acknowledge that it's very important. So I just wanted to add that.
And to piggyback to that, I think with Megan's help, I think we're able to now expand some of those data collection efforts through the mobile medical clinics. We're gathering, are you insured? Are you uninsured? Was it your first time that you had your mammogram? When was the last time you had it? Those kind of, data are helping us and kind of get a better picture of what's happening out in our communities. I think, this is spot on. I think I'm glad we're going to have a further or greater focus on the data collection, because I think it's very valuable.
I would also point to other things. We need to get a lot more sophisticated about what data and clear about what data we're asking our grantees to provide back to us, right? And make sure that it answers how we want to reflect the impact of the dollars that we spend, right? The second thing, we need to simplify some things. We need to taxonomize, prioritize the metrics. Not all metrics are created equal. They can't, right? We need to decide as an organization and align the structure of the metrics and the data that we're collecting to the rest of the strategy in a way that says, here are the major things that we do. And here are the top 5 things. When we talk to the world about the impact of our organization, here are the 5 big numbers that they need to remember. And under that, if we go into the specific initiative or pillar in this case, here are the 10 additional components that we're talking about. And then when we go into the programmatic level, it becomes even more broken down and we have maybe 20 metrics, right? But that taxonomy, if we go out to the world and talk about the 50 things that we do, nobody's going to hear it. And we're not doing that today. Keep in mind, we're talking a lot about external. We'll talk about that later. I just want to point out to you that there were no comments about 4.1.1. Do we feel like today we have the tools, resources, skill sets that we need to become a data-driven organization? Raise your hand if you have a degree in data analysis in this room.
We need an epidemiologist.
Yeah. Right. Yeah. So we need to think about the skill sets that we have in the organization. We need to think about the tools that we have within the organization. Anything else regarding Goal 4.1 and initiatives 4.11 and 4.12?
I think one of the initiatives, and maybe it's under 4.2 a little bit, but I want to bring it up and we can decide. But part of it's going to be not just collecting it and keeping it internal, because a lot of this is about us, but it's that point about where is it as an initiative here to go out and then share this as an initiative, because Is that 4.22?
all.
Partners around,
all
partners around shared data. But I think, maybe it's under there. But I want to make sure that it's very well highlighted that you got to share the data. Don't keep it internal here and we know what's going on, but really it's an initiative to go out. And it goes back to one of our other pillars about, I think, awareness, and these kind of connect together because they really should go out and share this data and begin speaking about it.
It also ties to partnerships as well, right? If you want to be a good partner, it's a two-directional path, right? You can't just ask for things. You also got to give something back. And we're in a unique position because an organization, one of the things that we heard in one of our previous visits is the organization dying to know what else is happening in the space with other organizations that are doing similar things, right? With other initiatives that try to do complementary, areas of work. They have no way of gathering that information today. And if you, as an organization, want to play the role of that, what do we call it? Architect, convener, whatever we want to call it, you have an opportunity to do that.
And as a tactic, I would suggest having, I know that we have like our annual report, but then also aligning maybe with like a state of the district. Other organizations, districts, cities have like their state of the city, state of the county. I think that's something that we could do as an annual basis where we actually share the information to our community, to the community.
And an example I to share with the data that, the infographics that we have released. Now, even with the vision clinics, we are having federally qualified health centers reach out to us and say, hey, how do we get a vision mobile unit? Can we explore that? Because they're seeing how efficient we are with our mobile units and the services, especially the specialty services like the mammograms, the pap smears, and now the vision clinic. I've had a call with Intercare, had a call with DAP Health that actually took out that 3 staff members went out, to our first mobile vision clinic to see if they want to explore them for their patients because they see how valuable they are. And I think, that's part of the work and some of the data that we're seeing out there that, through the infographics and the reports that we're releasing, there is an audience for that. And we see some of those, entities come in asking, how can we do that for our patients?
And I think a point that we should consider is how the data helps us identify the gaps that are out there in terms of what we're not doing.
Great.
Exactly.
Absolutely. And compare between different programs, right? Your resources, granted, you're going to have a lot of resources coming in with the cell, but resources by definition are limited. So you're going to want to be able to compare things. Now we can talk about what in that comparison we communicate out to the world, and we'll start talking about what we communicate out. But we want to understand if we give $1 million to this program and $1 million to this program, and they're both aiming to do the same thing, which is great. At the end of the year, we're going to want to be able to say this program generated X and that program generated 3X. And today we can't necessarily do that. There's a lot of apples and oranges comparison in what we have today. Okay, any other comments? We're leaking into the external stuff, but that's fine. Goal 4.2 is all about being the voice for the data and the enabler and the convener. So that's exactly what you were talking about earlier. Enable data-informed decision-making for our partners and community. By the way, it's not just our partners. It's also individuals and communities, right? They need to know what's happening in their space. Through data aggregation, reporting, and partnerships. So we already started diving into this, which is perfectly fine. Initiative 1, enable shared data access and insights, enable collective access of timely, relevant, there's a word missing there, timely, relevant, and actionable health data through shared platforms, reports, and analytical tools that support collective impact across the district. This doesn't mean that we need to collect all the health data in the world. We need to be thoughtful and selective about what we're collecting, what we're reflecting back to our stakeholders.
Okay, so my thought is, of course, all of this is very important, and it might be going back to the awareness, but the data-driven part of the district also should be able to personalize it. If it can be personalized so that it connects with people, so that whether that I think we have to make an effort, a conscious effort, to not be so scientific that we lose sight of the person, the individual. So is there
I'm not sure I understand.
Easy to read, like
Yeah, I get it.
Letty, story behind the numbers.
It's basically telling the story from the data, but I think that could be a tactic under the external distribution of data.
That's a part of the reporting, right? That's the storytelling part of the reporting. So for example, you just mentioned a state of the district report. That's where those human stories, those individual stories of success, and that's where those types of things, they're incredibly important, by the way. When we talk about data and we talk about decision making using data, we always overestimate, the collective, we always overestimate the role of data in decision making. 90% of our decisions are not made through rationale, they're made through emotions. So it's very important to use the data, but wrap it in emotive stories that resonate with the audience that we're talking about. Different audiences also mean different stories, right? If we're talking about trying to change legislation and we have a meeting with the governor, we should be telling a very, very different story than if we're in a community event.
And I love that we would be like the data hub. Just a quick example, I got a call the other day, like, hey, what's the asthma rate in the Coachella Valley? Right. And so that's some information that we were able to pull from our report. So I want the district to be that hub, like, hey, legislation. And so I have a question. And so they'd be able to add us to like their report, their fact sheet, and use us as a credible source within the area.
Yeah. By the way, there's also a marketing and communication, because once you have built these capabilities, you need to let your stakeholders know that this exists. Otherwise, you've built it, but nobody will come.
We were going to send a newsletter.
All right, I'm moving on to the last initiative, convene regional learning and insights. This is where it all kind of comes together to turn this organization into what Sophie began the conversation today with, describing the amplifier component, who we want to be, right? Convene partners around shared data, guidelines, and learnings to build buy-in, align practices, strengthen the use of data as a core enabler of collective impact. Maybe I would add somewhere in there, enable shared learning between organizations could be something that we might want to add there, but. And this is where I 100% agree. Like, to me, this means once a year, the health summit. And that's something that you in 2 or 3, whenever we get there, that's something that should be your baby. The Valley's Health Summit should be your baby. Word of warning. If you try to do all the activities of 4.2 before we get 4.1 right, you are heading into a world of pain. You have to get 4.1. You have to make sure that your own house is in order before you start bringing other people in. I've seen lots of organizations try to do this in parallel or just do 4.2 because it feels good and it's like raises the profile of the organization and all those things. But if they don't have, their stuff together, weak foundation, and it's going to come out real fast. And by the way, it's going to create distrust with your partners and communities. You get one chance to make a good impression.
Yeah, my comment is something that I attended when we had the Clinton Initiative in town, and they convened a meeting of all the grant makers in the Valley. And the first thing that they all said was that we need to do this again. to work as partners. So that was really a valuable meeting.
Question about relevant, going back to key initiative, I think 4.2.1 is the determining what's relevant. What do we mean by what's relevant? Is that in the tactic area? Okay. Yeah, the thought I had just going through my mind about this, and I saw it in here before about like patient satisfaction surveys, but also workforce. Right, because if we see 500, we meet all of the goals, but everybody's miserable, the work environment is not good. Things that we want to know that too, right? So I'm just wondering, so I guess it's under tactics.
Yeah, and we actually started that conversation today with Megan, starting to think a little bit ahead. We're going to need to identify what are the metrics that matter in each one of the areas of work that we're landing on here, right? And those might be different. So in talent and recruitment, there may be 5 metrics that are must-haves that we're going to ask all of our partners and all of our grantees who work on any effort in talent and recruitment. You guys have to report on these things, because without those 5 things, we can't tell whether you're doing a good job. And then there's a list of maybe additional 10 metrics, which are really good to have. And then maybe a list of another 30, which are nice to have and will help you understand whether you're doing the right things, and will help us understand what works and what doesn't work, but they may not be must-haves. So we're going to introduce like frameworks like Moscow exercises, which stands for must, could, should, won't, things like that into how we're thinking about metrics. Not all metrics are created equal. Not all data is created equal. By the way, collecting too much data is also a real problem, right? That creates chaos. We want to identify the right data and then make sure that we get it from them in an efficient, reliable manner so we can make smart decisions quickly.
Will there be also room for like customer satisfaction?
Sure. I don't know what the right metrics are. We haven't gone through that. If we decide that that's a super important thing for us, great. If we decide that that's a completely meaningless metric, let's get rid of it. It's just wasting our time.
And I guess I mean it more with the grantees in the district so that we know how we're serving them.
Sure.
So I like all the ones that we have, and I really thank you for helping me get a better understanding of it. Okay, so we're looking outward. Now I'm wondering, how do we, is looking inward, should that be a strategic pillar? Looking inward is what I'm thinking of, not only the data, but how we conduct ourselves, the board, because we spend a lot of time on governance, on diversity, on being trying to inform the public, to be transparent and all that. So should we acknowledge that we are a public entity, and that we, in order for us to be better, that there are certain things that we should prioritize to be strategic in how we conduct our business. And for example, today we had a committee meeting earlier today, and we had a finance meeting. And I think that if we had had a magic ball, that we would have probably done some things differently. Okay, we don't, and it's not feasible. So how do we get better? We talked about adding some positions that are, the people that somebody say epidemiologists. And I think we have great staff right now. We have great accounting people. And so I'm just wondering, this is aimed at how do we get better as a board, as what we've been entrusted to do, and how we conduct the matter of the business of the district to make better decision making. So is that something that we would include?
Yeah, absolutely. So I think 4.1 addresses exactly that. It's all about thinking internally, what is the data and information that we need to make smarter internal decisions, prioritization, those types of things. So absolutely 4.1. In terms of directly answering your question, how do you progress? I think a lot of things are going to be required. But to me, a couple of things stand out as key. One is through dialogue, what we're doing here. And the second thing is step by step, right? So notice the process that Sophie has been leading in this project. It has really taken us in a very, very pragmatic way, step by step by step, right? If we would have on day one tried to have a conversation about all the things that we're doing, all what's effective, what's not effective, and all the things that we should be doing, that would have become a very, very messy conversation very, very quickly.
So while you're putting that together, that thought, let me just add, is that now that I'm reading it, I could see where how this would address what I just said. But if I had just saw this without you telling me that's where it's at, I wouldn't have gotten that. So maybe be a little bit more specific to be able to spell it out a little bit better.
I also think that if you answer your question, the work that Larry Walker is doing on governance is about implementing this. So it's not just in this pillar, but the way this plan is going to be implemented and the roles and responsibilities across the organization will have to be clearly defined.
I was wondering if it should be a separate goal.
I think it's an implementation tactic. It's the way, this is the way this is going to be brought to life and how it's going to be brought to life through the organization.
Because right now it's under data maturity. And I think we're talking more about governance.
We are. It's two different things. There's data governance and then there's governance with how this organization is run. So I still think it's in both places. It needs to be in both places. And the way that, once we have this nailed down, we will talk about the implementation and the organizational realities that are today, where you are today and how you're going to get to where you need to be tomorrow. And we had this conversation with Megan when it comes to impact measurement, when it comes to even just having different staff being responsible for different pillars, for example, you're not there today. You don't have the staff that you need. And it's not going to happen overnight, right?
So that last point is super, super, super important, right? This is evolution, not revolution. And progress rarely, if ever, happens through revolution. Sustainable progress happens through evolution.
I like revolution.
I know it feels great. But it's important to recognize that this is hard to do. There's a lot of considerations. There's also the change that the organization can absorb, right? Like anytime you introduce change anywhere, there's friction. It's not a bad thing. It just is, right? Like it's laws of nature. So it's really important that we're mindful about how do we want to sequence this and that we enable the organization to actually absorb and execute against these changes in a practical way that creates sustainable infrastructure. The key is sustainable infrastructure, right? If we create a revolution and we implement some new things that, if somebody leaves and they leave all that they take all that institutional knowledge and there's no actual infrastructure in place, we've done nothing. Less than nothing. We've wasted money and time.
And really quickly before your comment, I am going to remind that we are looking at this to be done and implemented within 5 years.
Yes. Okay, that's great.
3 months.
Right. Well, there's something on the agenda for the policy committee that I'm aware of that you guys have heard me over and over again, like, what did Carol put that back on the table or under the table? And I've always advocated in terms of internal governments is to have expert advisors from the community be involved. I know that I just heard somebody say that we need an epidemiologist, which is, part of it. But we also just had 6 other uber qualified candidates apply to be a district director that, we should invite to help us on our committees.
Absolutely, absolutely. And that's part of the community feedback and that community loop. And that's the other. The other
Jeff
thing I
has
will
a
add-
question, team.
Oh, sorry.
Yeah, Letty, I was just gonna say, I think, hold that thought and concern for our meeting later this month with Larry. I think that's a good subject to discuss with Larry, those concerns you brought up. So, I mean, it's fine if it's in this key initiative reference, but I think that's going to be a good place to address it. So.
Guys, I want to be conscious of time, everybody's time. I think we are getting a lot of really great suggestions for activations and how we're going to manifest these things. It sounds to me like everybody is comfortable with this. These are the things that we need to get right internally. These are the things that we have an opportunity to improve on externally. I would advise adding after we get our stuff together internally. Any other questions, thoughts, staff? Great. I'm going to hand it over to Sophie.
Okay, so I just want to make sure everybody's had a chance to weigh in because that's really, really important. Everybody feel good? Okay, so thank you so much for an amazingly productive session and for participating with so much enthusiasm. We really appreciate it. As we said, this is co-designing. It cannot be done in a vacuum, and the more stakeholders participate, the better. So here's our plan for tomorrow, because you will see us again tomorrow, even though we did a great job today. We have two things that we'd like to cover tomorrow. One, we'd like to tap into this energy that is happening right now and just spend 45 minutes just kind of doing a lightning session of what tactics do we want to put underneath each one. Like, again, just give yourselves the night to think about it and for ideas to percolate and, that you want to share, that we want to capture before we go to the community sessions. The second thing is we'd love to briefly take you through the outline of the community sessions. So you know what's going to be happening in your district, how you can participate, and some of the guiding principles that we are using to design these community sessions and some of the logistics we're thinking about. But again, you know your community better than anybody. So we'd love to hear if there's anything that we are not thinking about that we're missing. We can jot it down and incorporate it before we go to the final plans. Does that sound like a good plan to everybody? So those are two things: quick tactics, lightning round, and then quick presentation of what we're thinking about community sessions, so that all stakeholders have a chance to weigh in and think about how that feels. Okay? Thank you again so much.
Thank you, Simon. With that, I am going to open really quickly for public comments on this item. Any comments? Public?
No public comment, no.
Perfect. Any closing comments from board members? All righty, then we'll go ahead and adjourn this